My name's Chris, and welcome to the Impact Lounge. This video features a conversation hosted by Stacy Huston, the Executive Director of SixDegrees.org. 6 Degrees is a charity founded by actor and philanthropist Kevin Bacon, and Stacy is a social impact expert who is also the executive producer of their award-winning podcast. This conversation is the second installment of the Empower Her series, and it's titled Maternity and Momentum. So in this conversation, you can expect to hear from some of the brightest minds in this field, like Alysia Montaño, an Olympian and world champion who is also the president and CEO of And Mother. And Mother exists to ensure that motherhood is not a limitation for women's professional and personal success. You'll also be hearing from Dr. Bio Curry-Winchell, also known as Dr. BCW. She is a respected physician and medical director at St. Mary's Regional Medical Center in Reno, Nevada. She's the founder of Beyond Clinical Walls, a platform where she elevates health literacy through relatable and educational content. And lastly, Karissa Raskin, the director of coalition engagement with the Listen First Project. She manages over 500 organizations that have gathered together to bridge divides in America. In addition, Karissa shares about Birth Culture, a cutting-edge organization with a big vision to change the world by training the next generation of community doulas. We're grateful you found our channel. Be sure to subscribe. And without further ado, let's hop into the conversation.
Welcome to the Impact Lounge. I'm your host, Stacy Huston. I'm the Executive Director of SixDegrees.org, and I'm honored to share that our work in amplifying changemakers through powerful conversations like these was nominated for 2 Webbies this week. It feels really good to be recognized for our work in amplifying the critical work of so many nonprofits and the champions that are spreading good. So I'm thrilled to continue our Empower Her series with this conversation that we're calling Maternity and Momentum, Bridging Gaps in Health and Opportunity for All Mothers. Justice and equity are cornerstones here at 6 Degrees. And as a developed nation, we have to acknowledge the critical state of our maternal health among Black and Brown women in the US, and also the truly limited resources and equity found for working mothers. So to discuss all of this and more, I am joined by 3 absolutely incredible guests, and we'll start by introducing each of them. First up, a remarkable advocate and a true ally in the quest for unity and health equity, Karissa Raskin. As Director of Coalition Engagement at the Listen First Project, Karissa masterfully orchestrates the collaboration of 500 plus organizations, weaving a fabric of connection and compassion across the nation. She's a visionary in community development, always fostering collaboration over competition. And I've witnessed firsthand her dedication to building bridges where divides exist. And Karissa's commitment really shines through her advocacy for birth justice with Birth Culture, uplifting those facing the harshest of societal challenges. It's a personal honor to welcome such a passionate change maker to our discussion today. Welcome, Karissa.
Thank you so much, Stacy. It's an honor, honestly, to be here and to be able to share more about the impactful work that Birth Culture is doing in Gainesville, Florida, and in Northeast Florida in general, and about the role that I've gotten to play as a supporter, really, of friends who have experienced and seen some of the most complex challenges and the lived experience of birth injustice to themselves, their families, their communities, who have taken a stand and done something dramatic and innovative to address those problems. So I'm excited to be able to share more about that in our discussions here today.
Same here. Thank you so much. And next up, with immense respect and admiration, I'm so excited to introduce Dr. BCW, as she's fondly known. This remarkable woman is not only at the forefront of urgent care at St. Mary's Regional Medical Center, but she's also a beacon of health literacy with her initiative Beyond Clinical Walls. Wherever there's a need for health education and support towards equity, you're likely going to find Dr. BCW there, lending her expertise and compassionate care. Her dedication to public health has echoed through the halls of policy and community alike, earning her well-deserved accolades such as Healthcare Hero Award. And as a TEDx veteran and a voice of authority in healthcare, Dr. BCW's commitment to nurturing well-being extends from her professional endeavors to the joys of her family and the serene landscape of Reno Tahoe. Welcome, Dr. BCW.
Thank you, Stacy, for having me. It is an honor to be here and amongst amazing panelists to raise awareness on this important topic. So I'm grateful to be here and to highlight, awareness, but also share solutions. So thank you for having me.
Oh, you're very welcome. We're excited to have you. And last but not least, it is an absolute honor to introduce a true champion in every sense of the word, Alysia Montaño, a celebrated Olympian and 7-time national champion. Her feats on the track are matched only by her trailblazing advocacy off of it. She's courageously championed the right of working mothers in sports and beyond, founding the nonprofit And Mother to ensure women don't have to choose between motherhood and their careers, a path she bravely forged without personal benefit. Her relentless spirit and unwavering voice have broken barriers and paved new roads for equity and representation. And I've watched in awe as Alysia has turned her personal trials into powerful advocacy, inspiring countless others to rise alongside her. Welcome to the Impact Lounge, Alysia.
Oh my goodness. Thank you so much, Stacy. It is absolutely an amazing opportunity to be here again amongst amazing panelists and just to really be able to share the work that we're doing now, where we've come from and where we're going. So, there's a lot of work to be done, knowing that, we have this incredible year being the Olympic year and this platform that we have to use sports as a lens into what we need in order to better support mothers and caregivers across all industries.
Absolutely. It is an Olympic year. It's also a voting year. And I feel like those things are interestingly colliding. It's so good to have you. And thank you for joining the conversation today. So let's jump right in. I'd love to start by kicking off a question to Dr. BCW. So I spent this morning at the Library of Congress with the Chambers of Mothers and several parental caucuses on the Hill who are all fighting to improve maternal health and the life of working parents in general. So some really startling stats were shared, primarily around Black and Indigenous women and how Black women specifically are dying at 3 times the rates comparatively to white women in the US. And that's already at higher rates than other high income countries, with 80% of all maternal deaths being preventable. So I know this is really personal for you, and I would love if you could share a little bit about the disparities you're seeing in healthcare, why you believe that they're there, and how you use beyond clinical walls to educate the public.
So as you mentioned, maternal health, Black maternal health is so near and dear to my heart. And I always like to share, why is that? I've always been rooted in how can we reduce inequities and disparities? I've been a champion of trying to find different ways to reach people. Well, an interesting piece is where I almost became part of this statistic that you just shared. And so, as you mentioned, Black women are dying at the highest rate during childbirth or shortly thereafter. And I had just given birth to my second daughter. And I remember I came out of the operating room and I knew something wasn't right. And I shared this information with my nurse and she said, Bio, everything looks fine. Your vital signs look fine. And so I sat with it thinking, okay, there's a problem. I'm not able to speak. I'm just not myself. And so, 10, 15 minutes passed, it got worse. And I asked her again, and I was dismissed once again. I ended up having to have my husband call my OB on my cell phone. So there I had that privilege as a physician myself to have his number and said, please come back and look at Bio. There's something wrong. So when he did, he recognized that I was not myself. And so I was taken back to the operating room and it was found that I was bleeding internally. And I was transfused multiple units of blood and hospitalized for 2 weeks. I shared this story Because often when we talk about Black maternal health, what is often socialized is it's an access issue. Well, I had the most access in the world and I almost passed away. I'm a physician and I almost passed away. I'm a Black woman who nearly became a part of that statistic. So this work is so important to me. And I was already a part of it and even more fueled after this, happened. And so I am utilizing the work that I've been doing through Beyond Clinical Walls, which is a platform that shares health information in a digestible, engaging, and an informative, free manner across the world that not only raises awareness on a wide variety of topics, but also helps you know what you can do with it. How can you advocate? Because when we talk about this, when we talk about Black maternal health and just all of the fractured pieces that we have within our system, it's going to take time to fix that. But one thing that I think I can do is help people arm themselves with the information to advocate at any point in their lives while they're seeking care. And so that is what Beyond Clinical Walls is about. It's a homegrown team, myself, my husband, and I put the videos out there, and I'm a practicing physician. So I always like to highlight that. So sometimes at 2 a.m., I'm putting these videos out there for anyone, just in hopes that I can help someone and reduce the statistics that I just talked about. So again, just grateful for this platform to highlight this. And I'm going to continue to share my story, even though it's hard, because I know I can make a difference, and hoping that I help a woman, a physician, anyone in healthcare to have a new perspective on this ongoing statistic.
I can't thank you enough for sharing what I'm sure is a deeply traumatic experience and being vulnerable, because I think that when we share those types of stories, people can connect and really understand the importance of leaning in and listening. And I think the work that you're doing on democratizing this sort of advocacy and education, literacy, as we call it, around these health crises that we might be experiencing and not know we are, or not know how to advocate for ourselves, is so critical. Because often communities are told that someone is a PhD or an RN, they know and you don't know, right? So if they say, no, everything's fine, respect that. And we see too many of these really, really tragic stories happen when, unfortunately, people aren't listened to. And I know that in your TED Talk, you talk a little bit about what that looks like, and that it doesn't come from a malicious place, right? Most of the time, it just comes from a place of not being educated and understanding what kind of implicit bias you carry, since we all carry implicit bias, and no one is set apart from that. So thank you so much for sharing. We really appreciate that. Karissa, I want to move to you. So according to a study done by the March of Dimes, it was shared that over 2 million women live in a maternity care desert, and that's seriously lacking some type of maternal health care access. So I'd love for you to share a little bit more about birth culture and how they're addressing this. A little bit of backstory: when we first spoke about your board role with them and how you're doing everything you can to really center these women that are working tirelessly at this social movement, it really left me and my counterpart moved deeply. And I just would love for you to share a little bit about birth culture and really how they're doing community building and focusing it on collective impact, and how your team believes that this sort of structure can speak to the mortality and health disparities that are happening disproportionately in the communities that you're serving.
Sure, I would be happy to. So yeah, my title here on the screen is with the Listen First Project, because that's the organization I work for my day job, but which is apropos for the conversation we're having. It's all about bridging divides, but my other role is as a board chair for Birth Culture, which is a organization that really believes in transforming the maternal health care sector and creating a culture of dignity, of integrity, and of equity for around birth justice. And so Birth Culture is a training program that is focused on training youth, primarily 16 to 24-year-olds, to become doulas. And for anyone who isn't familiar with what a doula is, think of it as an emotional support and empowerment liaison for women and families that are going through their birthing journey. It's not about just the birth, it's about the entire experience, prenatal, birth, postpartum. And the beautiful thing about Birth Culture is that it is created by the community for the community that it serves. And my dear friend, Jennifer Ravel, who is the executive director of the organization, would be here today, except she just had her third child not 2 weeks ago. And was sharing with me just the other day how, similar to Dr. BCW, someone who is very knowledgeable and skilled and has all of the information she needs, nevertheless was experiencing some of the same challenges that her organization and we're here talking about today in terms of not being listened to, not being heard. And so my role with Birth Culture is to be able to help create space and a voice for that organization to thrive. I love, Dr. BCW, how you were just speaking about the empowerment role that is necessary, that, we know our bodies. We know our bodies better than anybody else. And the beautiful thing about doulas is that while they're not direct medical providers, they are there to be able to help empower and give voice to the women and families that are going through the birthing journey so they realize their own power. So they can take advantage of the fact that they have the best knowledge in the room. And they are able to convey it back to the doctors and doing so in a way that is culturally relevant. Our training program at Birth Culture is unique. And there are other, doula training programs out there for sure. But the unique thing about this is not only is it focused on youth, so we're training the next generation of doulas and community birth workers, but the curriculum itself has been able to integrate history, culture, and relevance in a way that allows the messaging and the teachings to be more than just a curriculum of knowledge. It's a curriculum of cultural appreciation and of understanding, of listening, of building relationships. And so the doulas that we train become confidants, if you will, to the individuals who they're going through a birthing journey that's scary enough. They don't need the challenge of being able to voice their opinions to doctors or others whom they feel aren't listening.
Thank you, Karissa. You touch on something really interesting, which is when we think a lot about health equity, a lot of times we're thinking about the physical and what happens around mortality or illness, but mental health is such a big portion that also needs to be addressed if we're going to talk about like holistic approaches to having better outcomes overall. So thank you for sharing. Next up, Alysia. So you're already a star and a super well-known professional athlete long before what I will call the race that changed everything. And I think while many may have saw a woman that was running late stage pregnancy, others just saw someone just like themselves, which was like a woman that was both pregnant and working, right? And I think that you started this national conversation, probably even global, about the challenges that professional women face, especially mothers, in sports, but also in other careers. And when I read And Mother, which is the name of your nonprofit organization, which we'll be talking about definitely, it really resonated deeply with me because I think about myself and all of the many things that make up who I am. And yes, being a mother is a highlight, and it's like a very big part of who I am, but it's also kind of like the latest thing on my resume, right? It's not the defining thing or the self-limiting factor in what I can do or can achieve. So I'd love if you could talk a little bit about like what motivated you and your own personal experiences as an athlete and mom to turn this into a broader movement for change, because it really feels like this was a choice. You didn't have to activate in this type of way, but you chose to. And I'd love to kind of hear a little bit more about that.
Yeah, I mean, you touched on so much. The reason why I ran at 8 months pregnant in 2014 with my first child is because I recognized that there was this huge gap in how we saw women in the workplace. And this just also happens to be my job. My job is somebody who uses their bodies as their business, as many of us do. Mine just happens to be a performing body. And, the holes that we're looking at are ones that you don't necessarily consider when you are first entering the workforce, like your contract not having things like pregnancy, postpartum, maternity that protect you and your pay. And this had been ongoing for many years. I'm surprised not the first person to ever become pregnant. I'm also not the first athlete that wanted to continue their careers in pregnancy. But I was one of the first people that got to utilize how we see social media now and the news cycle in order to impact change. And as I mentioned the news cycle, it's important that I do so because we recognize that it's a very short period of time. And then we're on to the next thing. What I noticed with sports and entertainment is we have more time in the limelight. We have more time on the podium in this, spotlight moment. And I recognize that this is not unique to sports. When we talk about the discriminatory practices and infrastructure that is not in place in order to support mothers and caregivers as they continue to pursue their careers, that we're looking at it being very binary. Let's support them either in the workplace or they can just be home. And the two of those worlds have not been existing in many industries. And I was not the only person. So I recognized the relatable space in which I was living. When people watched me as their favorite athlete, they were also seeing themselves within me. And I had a real opportunity to make change. It's why I ran again in 2017. Go figure, 3 years later, we are still facing the same issues, but there not being much policy change. And so that's what led me to write the 2019 op-ed that I wrote in New York Times, where I, kind of blew the lid off of what we were experiencing, where we can talk about all of the change that we wanted to see. But ultimately what we really need is for, change to be activated. We need for there to be real policy change. We need there to be real infrastructure change. And how do we do that? So that's why I founded the nonprofit And Mother, because, I recognized that change wasn't going to happen unless we really activated change. And so we've developed a maternal wellness program, where we are working with our narrative shift and our educational programming, allowing there to be spaces for resource where people, like Dr. BCW has talked about, people wanting to ask the questions, how do I advocate for myself? What are some resources that I can utilize in order for me to advocate for myself? And then again, with our individual support. So it's grant giving. It's still recognizing the gaps that exist. We definitely don't want to be, the crutch forever. We don't want to be putting a Band-Aid, on a much larger issue, but we do recognize how do we allow for our athletes specifically to move forward in their careers when there still hasn't been infrastructure change that they need to see? So our grant giving is a really big part of the work that we do because it's able to support parents and caregivers, on the playing field and off of it.
Thank you so much. And you touch on a lot of really powerful things there, but the piece that really stands out for me is the transparency. I find that even when we're talking about pay transparency and all of these different things, I live in the state of Virginia, and a bipartisan bill just got knocked down by our governor that was about just pay transparency, and everyone was for it. And I feel like when there's secrecy, then we aren't able to actually help ourselves as easily, right? So if when I think about you kind of writing that op-ed, that didn't just take courage. You were really going against the grain, right? You're going against what we're told is a good, being a good citizen, a good employee, a good sponsored athlete. You don't slap the hand that feeds you. And what will this mean? Will other, sponsors want to bring you on or bring other people on? And I think that type of fear mongering gets us to stay silent. And if we're not talking about it, if we're not bringing light to those dark places, then there'll be no change because you won't be able to find community. And I can only imagine that when you wrote that article, so many other people started saying, me too, me too.
Yes.
Right. Actually, much similar to the Me Too movement, right? Like when you think about that, it's the same thing, right? Then we find each other because we're now talking about it. We're not being shamed into silence or feared into silence, which is sometimes the greater thing, especially when it talks about our livelihood.
Absolutely. And just to touch on that, just 2 weeks after I did my op-ed, Allison Felix came out and talked about her story. She had her child 4 years after I had mine. So we're talking about the most decorated female track and field athlete of all time, also not recognizing or being recognized for her work and her motherhood, was either or for her. So it was really big and really impactful. And like you mentioned, like the visibility of the work that we're doing is important. And it's how we're using sports as what we know. It's a microcosm of what's happening in the world, and we're using it for change.
It's powerful. Thanks for sharing. Back to you, Dr. BCW. You use social media and traditional media pretty prolifically. And I would just love for you to talk about how this is useful in raising awareness and useful in also the narrative shift about health literacy. What you find most meaningful about it. Because I know sometimes people are a little bit more shy to use social media, how to engage in it appropriately to really start a movement in advocating. But anything you could share, I think would be really helpful.
Well, when I decided to become a physician, I knew I wanted to help people. But then I felt like when I graduated, I was thinking about all the community work that I was doing. And then, of course, the work within the clinic. But I thought, why not spread this information farther? And I'll give a story behind that kind of drive. So my father, who was 99 years old, World War II, Korean and Vietnam, he was a triple war veteran. And Stacy, I grew up being a part of communities and helping and advocating. I had no idea sometimes why I was there or what kind of sign I was holding up, but I knew I was standing up for something. And so that feeling, I just wanted to create, what could I do to put it forward? Because that blueprint was already there. And so when I graduated, I thought, okay, I want to reach people. Why not social media? And I thought, how can I reach the masses? So I decided, you know what, I'm going to create Beyond Clinical Walls. And I'll give another little piece. So Curry, I wanted my dad to hear his name when I walked across the stage. And a lot of people were like, that's a long last name, Bio Curry Winchell, my married name. And who would have thought it would have reflected and become what I believe in? And so I thought, okay, what can I do? So with social media, I thought I can reach a lot of people. So I just started writing because I've always loved to write. And I thought, if I can share the information that I've been privileged to know, but water it down, but make it impactful, so anyone listening can feel like, oh, I now know more about this. I now can do something with this. I thought, let's do it. So just started writing. I ended up filming at different places, but then decided to create a studio in my home. And my husband, who has a full-time job with a company, learned on YouTube a couple of years ago how to create these videos. And we wanted to infuse it with imagery that was diverse, because often, as we see, when you see health literacy, it is often not culturally and linguistically competent. So I thought, I'm going to do this and I'm going to live in authenticity, because it's not part of any of the hospital systems that I work with. This is ours. And so I just started putting the content out, and it was amazing. The responses that I continue to get, where people are like, I was diagnosed with diabetes or hypertension. I have no idea what this doctor was telling me. And now I now know what to do. And so I just kept pushing and pushing and just, I'm putting it as far as I can reach. And then of course I do national television. I write for multiple publications. And the reason why I utilize so many different mediums through social media or through traditional media is because we all ingest information differently. So why not pepper it with every single piece that I can, including in the clinic, and help people? So it's been a fantastic, just gift, because I feel my dad always said, Bio, think of one thing you can do each day to give back. And when you help others, you're helping yourself. And so that has just been my drive. And my heart is just full of joy to help people as widely as I possibly can.
What a legacy for your dad. That's really a very sweet story. Thank you for sharing. Karissa, back over to you. So Brandy Sellers Jackson, so she's an author, an activist, and senior digital director for Ergo Baby. So for our moms out there, our baby wearing gear. So she shared recently about 3 very different birth experiences that she had when she gave birth to her 3 sons at different times. And it wasn't really until the 3rd where she enlisted a doula, and she kind of joked that she thought it was like a fancy thing, like people were doing too much getting a doula, like what is this? Until that 3rd baby, when she was a little bit older and enlisted this kind of expertise, and she experienced it that 3rd childbirth experience was where she felt safety. And that was really what set it apart. The word safety is what she said resonated so much with her. And you touched on this a little bit earlier, so I thought it would be interesting to kind of pose the question to you. Can you share how birth culture leverages like the compassion and really collaboration and community to create this kind of impactful change that you believe is needed in the equity of care, especially around this birthing practice and doula specifically, what they bring?
Yeah, that's, oh my gosh, I love that question, because as I was thinking, to myself, what is it that's lacking often in these community spaces? And I think, Stacy, when you and I spoke prior to today, we were talking a little bit about how it isn't like necessarily normal that mothers are expected to rear a little one on their own. Like that isn't the way that the world worked. It's what our society has created for us, and throw going back to work on top of it and all of the other things, and mother, as but it's so interesting, because when we think about safety, where is that safety? What is that safety net? What does that look like? And particularly when birth culture was created, the idea of it was around creating that safety net for some of our most vulnerable mothers. And well, definitely within the BIPOC community, but even looking at the youth, like teens and young adults who have just given birth, and in recognizing that it is something stigmatized in our society to be a young mother, often, especially a teen mom, and even from the cultural norms sometimes of not talking about reproductive health and just not being able to talk, not being able to share, not being able to be seen and get the support that's needed. It is, we are isolating people at a time when they are at most need for that community support. And so what is the value of a doula? Well, it is inherently created for that. It is someone to sit there by your side, be available to help walk you through something that, whether we've done it once, twice, 6 times. I'm one of 8 kids, so I can sort of speak from experience with my, through my mom. Yeah, I know. But there is always going to be something new about the birthing journey that you're not expecting, no matter what the circumstances are. And we are programmed, I think, especially in our country, to pull yourself up by your bootstraps, be an independent, strong person, do it on your own. I had a similar, I think, feeling to the woman you quoted of, what I would think about getting a doula. Well, that I shouldn't have to do that. That shouldn't be a thing that I need. And yet it's the bringing in of a social safety net and a confidant who can just help you get through something that we were inherently programmed to do with community support. So that element of safety, I think, is really pertinent. And then to talk about like the collective capacity, just speaking specifically for birth culture. I'll tell the story of kind of how I got into this space. So I was working for the University of Florida in Gainesville, and then also moved over and worked at the city. And my job was to be able to create partnerships to allow for community members who had lived experience of some of the most complex challenges in our society and give them the opportunity to have their voices heard. And not just have their voices heard, but I needed to take it a step further because I was so tired of their voices being heard and nothing being done. So what was going to be the difference here? We needed to give them access to resources to take their ideas for change and actually create something. And so I had the great privilege of meeting Miss Jennifer Ravel, who had this beautiful idea of bringing her practice of doula and being a doula to offer it to our youth and our community to go back and serve others. And in this process, she has pulled in the most amazing women who are doing the most phenomenal jobs in the community, representative of the community themselves, who have poured their hearts and souls into this program, this 15-week intensive training program for young women to be able to become the support system for their friends, their neighbors, their future mothers of the community. And it, in and of itself, the community that's building out of birth culture is transformative. And so I think just the act of putting heart and soul into this work is creating a safety net. What I, as a contributor and an ally to the space, would love to be able to do and do a better job of, honestly, is getting access to additional resources for those women to be able to pursue their vision. And what is so fundamentally clear to me and clear in the data and clear through our experience, that this is a need, not just for our community, but for communities like ours across the country.
Oh, Karissa, absolutely. You touched on so many things there. I think the blueprint is clear. And so much of the work that we do at 6 Degrees is centered on connection, not just through like the separation theory that Kevin is famous for, but because we believe that community and connection is the center of everything. And it's so ironic that you talk about the whole bootstraps thing. I do a keynote and I use that exact phrase, and I warn of the dangers of this do it on your own ethos that we have as a culture. There's a reason why they say it takes a village to raise a child, because it takes a village to raise a child.
Right.
We're not meant to do it alone. We're meant to be in community. We're meant to be resourced. And in fact, there's so many studies that talk about the longevity that people have in living when they have more human points of connection, right? The most people that live over 100 years are people that have, more than 5 touch points of different humans in their circle every day, right? Like there's a real need. We don't just survive, we thrive with that. So no, it's a powerful thing that you're working on, and we appreciate you sharing. I'm going to move to Alysia. So there are 2 organizations, the 5th Trimester and an organization called Vivi, and they shared a report based on, it seems like you might know this report, on a study that they showed that in summary, workplace support for parenthood actually drives profits. And it was something like for every dollar that's spent in workplace support, like childcare subsidies, on-site childcare, paid leave, those sorts of things, $17 was generated for the organization. So essentially an ROI, right? And that comes when employees are more engaged. They're staying longer. They're not looking for new employment. They're not disengaged and upset with their employer, worried about their kid at home. So they're not able to focus on their duties, and they also have that time to recharge after giving childbirth and or caretaking for a child, that time to bond, right? And those sorts of things that add to what we touched on earlier, which is like the mental wellness, that piece that's often left out of the conversation when it comes to this. So we talked a little bit how you were really instrumental in helping Nike shift their practices and policies with their athletes. So I would love if you could share like what actionable steps that you think individuals can do to support and empower mothers, and even organizations, if people are tuning in and they have the power to influence, like we all should have, the companies that we work for. Like what systemic changes really need to take place to ensure this kind of equitable maternal care and support postpartum.
Mm-hmm. Yeah. Well, you brought up a lot of really great things. I just wanted to touch back on what Karissa had talked about. Yeah. We were never meant to do this alone. And it works. So it should be so very true when we're talking about it in sports. We understand we need a team behind us in order for us to succeed. And so again, when we talk about using sports as like the lens and the driver towards the infrastructure change we want to see in society, these are the touch points that we're talking about. And so the other point that you mentioned is just the return of investment. You look at your athletes towards, seeing, okay, these are the experts in wellness, right? So my favorite athlete loves these shoes. My favorite athlete loves, this apparel. And you recognize when you see the authenticity through, as you follow them, you can trust this company. We know if we see our favorite athlete, let's just say it's Alysia Montaño, and she is wearing these shoes, she's become pregnant, she's had her baby, and they have stood behind her. We know that they support what I need in society as a parent, caregiver, mother in my pregnancy and my postpartum journey. And this is a company I can look towards and I will continue to buy from. These are real data points that we know support the importance of supporting mothers. And so, when it comes to individuals supporting moms in their pregnancy and their postpartum period, what I ask for is you to look towards the companies that you see continuing to support your favorite athletes. It should be, the proof should be in the pudding. It should be very visible. It should be accessible to you knowing. And if it isn't, I would question it. When we talk about corporations, companies, governing bodies, I would like to put the major onus on them to be the drivers of change. So we're talking about access to affordable childcare. It isn't hard to implement a childcare grant. When it comes to, okay, what are my favorite athletes, or what are the athletes that we know are representing the U.S. team that we should actually help support to getting to their pinnacle of their sport? How do we do a better job of making sure that there isn't a drop-off point? And, when we're talking about the congruency and like the space of connectivity when it comes to professional athletes and how we see them in professional careers across the board, we want to continue to see athletes grow into their sport. We don't want to see them drop off. And we've seen this statistic for the longest time, especially as I was kept growing into my parenthood journey as a professional athlete, continuing to break records in my postpartum period. We'd seen so many people say, like, we haven't seen this be done before. And I just say, because they haven't been supported to do it. The statistics are sitting there because suddenly you have seen the loss of support from these athletes when they walked into their pregnancy and their postpartum journey. How do we continue to fund our careers if we're not being funded? So again, that's the biggest point is for individuals to make sure that they're looking for the proof, that they really aren't just hearing companies talk about these campaigns and they're actually seeing it within their favorite athletes. And then when we talk about companies, organizations, sponsors, governing bodies, like what are they doing to actually institute maternal funds that support, the progression and the continuous career trajectory of their athletes?
That is such real clear advice around this. I can't thank you enough. We talk a lot about this in the work that we do around just corporate social responsibility and how, I think Gallup or McKinsey, one of these guys did a study that showed 70% of people would pay more for a product if it aligned with their values. And so that's really what you're talking about. It's like if they're supporting this athlete, if they're supporting something you care about, then you can invest in them because that's what we're seeing. That is social impact, right? That is social change. And with this next generation moving into the scene and having buying power behind them, I think it's only going to increase that. And companies, to your point, the onus is on them, right? That I think that we can see through as a society inauthenticity and when companies are greenwashing, if you call it that, or not doing something that really feels authentic or fully addressing an issue. And so I really appreciate that kind of way that everyday people can kind of look and say, I'm behind this because this is someone that I'm inspired by or I admire, and they're supported by this brand. It's a really great way to think about it. So thank you.
And I wanted to hop in on that, Stacey, because, what she mentioned was so powerful, because when we talk about this community feeling of health delivery, it is, when you talk about an athlete embodying those pieces and really sharing the wellness, you're sharing the wellness that you have, and you're also helping your fans get wellness. There is a bridge, there is a connection there. And so I think if more organizations understood that and took note, you could really make an impact on how we deliver healthcare in a new format, because through those statuses, that's how you're going to really reach people, whether you're a famous athlete, whether you're, in all different pockets, utilizing that and pair up, because this individual piece is not the way to do it. And we have to also grow representation as well, because, I think about, it really struck me what you said, because as a Black female physician, I represent less than 3% of physicians in the US. And so here, trying to make this mark on society to help people, we need to grow up and have people part of us so we can have more people on the pipeline. So it just struck me. And it's so important to have those connections on all areas.
And now I just have to jump in, because that's exactly why birth culture exists and the framework that it does, because it's the entire idea that the only way to change in a community and provide that support is for people who look like the community to be there to be an advocate and an empowerment source, so someone can be their own advocate. And that's why the program exists as an apprenticeship training model, to be able to lead by example, to have our community doulas and birth workers and maternal healthcare workers who predominantly do and to your point, Dr. BCW, there are few Black women who are in that space. But the more we can bring this training to our young Black women in our communities, allow themselves to see that there is a potential and a future for them in that space, and we start to grow that pie, then is when we really start to create the change.
Agree. It's twofold. And that's the other piece. Like when I think of Beyond Clinical Walls, I'm hopeful that people will see and think, I can be a physician. I can help in this way. And so not only am I helping, share health information to patients, but I'm hopeful that I'm going to get more Black physicians think about doing this and putting it forward. So it's a two-way street in hopes of helping on both ends.
This is so just poignant right now. Diana Taurasi just talked about how much we tell, little kids they can be anything that they want to be, but then there ends up being this barrier when you walk into, especially womanhood, layer it with Black womanhood, layer it with motherhood, when you tell me that, show me it. So, I mean, we are just right now, the connectivity is everywhere that we want it to be. And this is what the village actually is.
I'm feeling so grateful for this conversation. And we have really arrived to our call to action portion that we have for each of our discussions. And I really would love for people that are tuning in, listening, our subscribers, to learn where they can follow you, learn more about your journey and also the organizations that you're supporting, or any last takeaways. I think we just shared a bunch of gems right there, but anything else you'd want to add as well? I'd love for each of you to go around, so it doesn't matter the order, whoever wants to go first.
I'll kick off with this here. You can follow us at our website at www.andmother.org. Tune in to our newsletter to find out all of the new happenings and things that we're working on. We have our Mom Forward 5K that's coming up in person and virtually on June 8th. It's going to be in Berkeley, California, the birth of And Mother, the birth of my Olympic dreams and goals, and, the birth of the social impact work that we're doing now. So you can get on our website, you can register and support us near, right next to me in my house or afar. And the other stuff is really just right now, it's the Olympic year. It's a really big year for us. And like we talked about, the funding and the support to get the athletes who are parents and caregivers to the Olympic trials to have an opportunity at an Olympic team, and then also to the game. So, have a look out for our funds and ways that you can support us by heading to our website. And of course, social media, a wonderful spot and great resource to see everything that we are putting out there at andmother_org.
Thank you. And we'll make sure to put all these in our show notes as well.
Awesome.
Dr. BCW, you want to share?
Sure. And thank you again, Stacy, for just this opportunity. The first part I'll start with is one tip to take to your heart and take it and share it is your health is your most prized possession. And so when you think about that, remember to advocate and not doubt yourself. So I share that with everyone that I can, that, don't allow people to dismiss your concerns, your symptoms. And if they're not listening, you keep asking and find someone who will listen. And so that is my tip as far as something to take with you for forever. You can definitely reach me at, I am on all social media platforms at dr_BCW. Also, I have a YouTube channel, Beyond Clinical Walls. And then you can also find my website, drbcw.com, and you'll find all of the episodes, all free, on a wide variety of health topics. And my TEDx, Do No Harm, please check that out. Really highlights Black maternal health and mortality and flips the script on what we think is the issue with this alarming statistic. So thank you for having me.
Thank you. Karissa?
Sure. I have a couple of things. So I've broken it down into like three different opportunities here. So from like a financial standpoint, certainly Birth Culture would be so grateful for any amount of donation that can be made. We are a grassroots organization that has one amazing executive director who, a mother of three and deserves beyond any, I'm going to get emotional. I'm not going to. Just deserves to be resourced to do the amazing work that she's doing. So I would be so grateful for any support that can come in. You can find our website at www.birthculture.org. And also say, in terms of a local community stance, look to see if there's a doula organization in your area and consider offering funds to Scholarship a Family, who may not have access to care. It can make the world of difference for a family to have this resource during a time of need. And along those lines, be an advocate to your insurance companies that there should be more support for doula care. There are some states that are starting to adopt it, but not all insurance companies by far are participating. And goodness knows they have the resources. And from a preventative medicine standpoint, it would be smart for them to. So help them to realize the return on investment that could be possible for them to kind of get behind the funding of doulas. And then in addition, I'll put on my day job hat. And from a listen first standpoint, I would encourage anyone who may be listening and have questions about this, or may have some assumptions of their own, or wonder, not really sure how any of the information we've shared today resonates. I would just say, have a conversation with somebody in your community who maybe doesn't look quite like you, has a different story to tell, has a different experience, and listen with empathy, listen with curiosity, and listen with an open heart, in that you may find something new about somebody else or a community of people that you didn't understand before. And by sitting down and having that conversation, they may learn something so valuable about you and your point of view as well, that maybe, just maybe, we're going to start to move towards a country of greater unity than division.
I think that's a perfect way to end. And I'm so, so grateful. Thank you, Chris, for that. Thank you all again. I feel extremely honored to be able to sit here and have this conversation. I appreciate the work that each of you are doing respectively in these different areas. And I truly believe that this conversation will be a gift for many, and those that tune in will walk away with more understanding, and also feel more empowered to learn how to be an advocate, to be thinking about, those conversations with mothers in their workplace, how they can create space and resources for, 50% of the population. And just really, really grateful to be able to just open up this dialogue as we head into Black Maternal Health Week. So thank you. And as for 6 Degrees, the way that you can support us if you are tuning in is by subscribing, commenting, and really importantly, sharing this conversation, right? So other people that you think could really benefit from hearing about this get a chance to, and consider sharing this in your newsletters and spreading this knowledge far and wide of all of these wonderful organizations that are worthy of attention and support. So from all of us at the Impact Lounge, thank you for joining us.